Medicare doesn't make any sense. So here at Healthcare Solutions Direct, our goal is to keep this really as simple as 1, 2, 3 for you. So we're going to discuss right now some of the basics of Medicare Advantage plans, as well as some of the misconceptions that individuals have when it comes to Medicare Advantage plans so that you are better informed. Medicare Advantage Part C is another option that someone will have to choose from their healthcare needs when they're actually eligible for Medicare. So remember, Medicare Advantage plans are like HMO or PPO that are provided by private insurance companies and not by the federal government. See, although Medicare Advantage plans will vary by plan, they must all provide the same, if not better, coverage as original Medicare Part A and B. Most plans will give some additional benefits that are not provided by the federal government. So Medicare Advantage plans should be viewed as an alternative option to Medicare A and B. An individual cannot have both Medicare Part A and B and a Medicare Advantage plan. They must choose one or the other. The reason an individual cannot have both at the same time is because a Medicare Advantage plan is an alternative someone has to original Medicare Part A and B. They have one or the other. Original Medicare is offered by the federal government, and a Medicare Advantage plan Part C is offered by a private insurance company. An individual with a Medicare Advantage plan will now have a private insurance company that's managing their health care for them and not the federal government. So let's talk about Medicare Advantage plans being run by private insurance. See, when an individual enrolls in a Medicare Advantage plan, they will no longer be enrolled in original Medicare Part A and B. Since an individual is no longer enrolled in original Medicare Part A and B, they cannot purchase a Medigap supplement to cover the cost sharing associated with the Medicare Advantage plan. The private insurance company will send the individual their own card to use for hospital medical services like that of individual and group insurance. This new card will now be used instead of the red, white, and blue Medicare card. It's very important to understand that Medicare Advantage plans are commonly advertised all the time as zero premium. You're going to see them on TV and through the mail. An individual will continue to be marketed these zero premium plans, so it's really important that you fully understand them. So we're going to take some time going over that right now. The reason Medicare Advantage plans typically offer zero premium plans are because they form a network with doctors and hospitals in order to help manage costs. This is very different than the federal government with Medicare A and B. With Medicare A and B, there are no checks and balances, so you can literally go almost anywhere in the United States without a network. With a Medicare Advantage plan, they form a network with doctors and hospitals in order to help manage that cost. That's why they're offered as zero premium. Again, Medicare Advantage plans are like group and individual HMO or PPO plans, and they advertise as all-in-one plans. Now, this might be a wonderful option for someone, so that's why it's important to reach out to us here at Healthcare Solutions Direct so we can look at your situation and see exactly what would work best for you. Let's talk right now about some misconceptions about Medicare Advantage plans that I think will really help you out. There are two misconceptions many individuals have when it comes to Medicare Advantage plans that we're going to address right now. An individual that can understand the following two misconceptions will have a much easier time being able to navigate their options and make the best decision for their healthcare needs when it comes down to it. The very first misconception that someone has about a Medicare Advantage plan is this. The misconception is that individuals have about that Medicare Advantage plan is that they're the same as a Medigap supplement plan. We've talked about this previously in a Medigap supplement video. That is incorrect because there are two different forms of insurance. Medigap supplement plans and Medicare Advantage plans are two different forms of insurance. Medigap supplement plans go with original Medicare, and a Medicare Advantage plan is its own insurance with a private insurance company. It's easy for anyone to assume that a Medicare Advantage plan is a supplement plan based actually on the name. That's where it gets really confusing. The Part C of Medicare has the word Medicare in it and the word Advantage in the exact same title. So that gets very, very confusing to understand that this is not a supplement plan to original Medicare. This is where a lot of the confusion begins that helps to contribute to this misconception that a Medicare Advantage plan is actually a supplement plan to original Medicare. So let's talk about some reasons Medicare Advantage plans still create confusion. Remember, individuals that enroll into a Medicare Advantage plan will still receive their Medicare Part A and Part B card in the mail. The individual does not need to send it back to Social Security. Since the individual still has a Medicare card, even though they may not use it, could be a reason someone feels that the Medicare Advantage is actually supplementing their Medicare. See, many individuals will continue to refer to their Medicare Advantage plan as their supplement, and few take the time to explain it to them that this is an alternative plan to Original Medicare and it's not a supplement plan to Original Medicare. So here's some important information about eligibility for Medicare. An individual that enrolls into a Medicare Advantage plan is still Medicare eligible, and they can take back their Original Medicare Part A and Part B as their primary insurance during certain enrollments during the calendar year. Medicare Advantage plans will typically require the policyholder to enter into an annual contract with that plan when they sign up. An individual can always take back their Original Medicare Part A and B. However, we talked about this in the Medigap supplement videos. If they do not have a Medigap open enrollment period OEP or a guaranteed issue period GI, they may need to medically qualify for a Medigap supplement plan, and they might not be able to be approved. Taking back Original Medicare Part A and B without the protection of a Medigap supplement plan may not be in the best interest for someone with a Medicare Advantage plan. That's why it's so important to talk to a licensed agent here at Healthcare Solutions Direct so we can advise you on exactly what the best option is for your needs. Let's talk about an example of why a Medicare Advantage plan is not a supplement. See, a Medicare Advantage plan will not pay the Part A hospital deductible of $1,484 in 2021 if an individual is admitted to the hospital or the daily coinsurance past the 60 consecutive days. A Medicare Advantage plan will also not pay the Part B medical coinsurance of 20% for medical bills. So a Medicare Advantage plan will instead replace those Part A and Part B hospital medical bills with their own set of deductibles, copays, and coinsurance charges. So since a Medicare Advantage plan will not pay the Part A and the Part B deductibles as far as copays or coinsurance, it cannot be a supplement plan to Original Medicare Part A and Part B. Medicare Advantage plans have their own charges that will vary. So each Medicare Advantage plan will have its own set of deductibles, copays, coinsurance, and networks, which makes comparing these plans sometimes a little challenging for an individual without the help of an experienced insurance agent. That's why it's so important to reach out to us here at Healthcare Solutions Direct and talk to one of our licensed agents to make sure that you're doing what's right for you and the best option for your healthcare needs. See, some Medicare Advantage plans will have some incredible benefits, such as no copay for primary care doctor and maybe a little to no copay for a specialist visit. The individual may need to take into consideration the network that's associated with that plan compared to another plan with higher out-of-pocket copays. Again, Medicare Advantage plans can offer some incredible benefits and protection, but an individual needs to make sure that they review the plan and how it affects their healthcare needs, since each plan varies in their coverage options. So that you're better informed as the consumer, since Medicare Advantage plans do not follow the same rules when it comes to deductibles, daily coinsurance like Medicare Part A, each plan will vary in the out-of-pocket responsibility if the policyholder was actually admitted to the hospital. So some Medicare Advantage plans will charge the individual maybe $300 a day for the first 6 days in the hospital. An individual only admitted for 2 days could pay less than if they had Original Medicare Part A as their primary insurance. If the individual were in the hospital for 6 days, it could be more expensive than the $1,484 Medicare Part A deductible. It all depends on exactly what plan that individual has. So some Medicare Advantage plans can offer a flat copay per inpatient hospital stay, and some may have no charge at all for an inpatient hospital stay. That's why it's so important to talk to one of our agents here at Healthcare Solutions Direct so we can see what plans are available in your area that give you the best coverage for your particular needs. The second misconception individuals have about a Medicare Advantage plan is that it will cost them nothing to join the plan since they're advertised as zero premium. We want to make sure that you understand how this actually works. See, many individuals can be surprised to learn that they must still pay the monthly Part B premium of $148.50 in 2021 to Social Security. Remember, the Part B premium never goes away when someone enrolls into a zero premium or any Medicare Advantage plan. This goes back to the fact that even though the individual is no longer enrolled into Original Medicare, they're always Medicare eligible no matter what option they go with. Again, this really contributes to the misunderstanding as well as the confusion when it comes to Medicare. So let's talk about the Part B premium requirements for Medicare Advantage plan. When an individual enrolls into a Medicare Advantage plan, the Part B monthly premium of $148.50 in 2021, which is the standard a month, is collected by Social Security, and it's now given to a private insurance company to help offset the cost in managing that individual's health care instead of them being on original Medicare. See, once an individual is eligible for Medicare, they must always continue to contribute to the Medicare system, no matter if they keep original Medicare A and B as their insurance or they choose a Medicare Advantage plan as their primary insurance. Medicare Advantage companies rely almost entirely on what the federal government gives them to manage someone's health care, and the Part B premium plays a very big part in that scenario. Here's something about Medicare Advantage plans that very few are told about. Medicare Advantage plans have the same price as original Medicare. See, when an individual compares original Medicare Parts A and B to that of a Medicare Advantage plan Part C plan, they are both the exact same cost. Here's why. The individual must still pay the Part B monthly premium of $148.50, which is standard in 2021, to Social Security, regardless if they keep the federal government as their insurance with Medicare Part A and B or they go to a private insurance company under a Medicare Advantage Part C. One of the benefits an individual will see with a Medicare Advantage plan when they're comparing the monthly cost to that of original Medicare, since they're both the exact same cost, is that it will come down to the out-of-pocket maximum, where unfortunately Medicare does not have that. With a Medicare Advantage plan, you do get a maximum out-of-pocket limit to what you will pay during that course of the calendar year, which unfortunately Medicare does not have. That 20% does not have a cap to it. Another thing that you should be aware of is this. Medicare Advantage plans get more than the Part B premium. See, although it varies from state to state, it appears that the average fixed amount right now currently that a Medicare Advantage company receives is around $900 a month per person in reimbursement from CMS to cover that individual's Part A and Part B costs. Since Medicare Advantage companies rely almost entirely on federal funding, some plans will get more from CMS based on the needs of that individual. These are known as special needs plans, which we'll talk about here a little bit later, that an individual can qualify for that offer benefits that are designed to meet the specific needs of that individual. Lastly, we're going to talk about how CMS sets the benchmark in determining that funding, so you have all the information that you need. See, each year CMS will determine what is called a benchmark for what it will give in federal funding to a Medicare Advantage company. Some of this funding is from Medicare Part B. However, most of this funding actually comes from CMS. In determining what they call a benchmark, what CMS will do is they'll look at each geographical area and compare what they would have paid on average in regular Medicare costs for that individual if they had Medicare A and B as their insurance. CMS will then set up a bidding process that the Medicare Advantage companies will then submit to them. If the bid comes in at or under the benchmark from the Medicare Advantage company, you'll see the plan typically offered as a zero premium. If the bid is above the benchmark, then many times the plan will charge a monthly premium in addition to the Medicare Part B premium. So if you're looking at some plans that have a monthly premium to it, that's because the benchmark came in higher, and that's why there's a monthly premium.